Prior to seeing Mr. Jones and determining if he's ready for early mobilization in the ICU, I would first like to look at his medical records. And the first thing I'd like to look at are his lab values. I want to see his lab values, things like the ABGs, the hemoglobin, hematocrit, white blood cells, blood glucose levels, just to determine if there's any contraindication for mobilization for Mr. Jones at this point. If the lab values are higher or lower than they should be, I'd like to ask the nursing staff when the labs were taken and if they could be taken again, and determine if we need to come back to Mr. Jones for another treatment session. So I'd first check the lab values. The next thing I'd want to know is if the nursing staff at all has been in to mobilize Mr. Jones at all, maybe getting him on the edge of the bed, getting him on a bedside commode, or maybe some bed mobility, like getting him on a bedpan, and kind of just to get a baseline and see where he is strength-wise, if the nursing staff has done so, and if not, knowing that I'm going in as an initial eval and be cautious when I'm moving him, knowing it's the first time getting him up. The next thing I'd like to look at is the ventilator settings. I want to know how well Mr. Jones is tolerating mechanical ventilation. What is his FiO2 levels? Are they really high in the 80s or 90% oxygen, or are they lower? If he's able to take spontaneous breaths or not. And that just kind of helps us determine if more oxygen supplementation needs to be given before we mobilize Mr. Jones, and just how well he's doing before we get up and mobilize him. The next thing I'd like to look at is his cognition and his alertness and his arousal. I'd like to see if he's able to be involved in the treatment session. I'd like to see if the nurse was able to get any response from him, whether it be like a hand gesture or like a hand squeeze or a blink, just to see if he's able to be involved and to see how I need to communicate with Mr. Jones. The next thing I'd like to look at is his medications. What medications is he on and when were they given? And if anything's been discontinued. So that way I know what medications could have adverse side effects and could affect our treatment session. And the last thing I'd like to know are his baseline vital signs, things like his heart rate, his blood pressure, his SpO2, his respiratory rate, and his body temperature, just to have a baseline to know where he stands before we're mobilizing him. So that way, if his vital signs go above or below where they normally are for him, I know that there could possibly something wrong and we need to stop or discontinue the treatment session for now and give Mr. Jones a break. And that's it.